We've all been there, having a headache and not being able to work or concentrate because of it. And mostly we just ignore it or just take some painkillers and go to sleep.
In this video, talking about some headaches we get without paying attention to uh, what really is happening, and sometimes we get our hearts racing. That is tachycardia. So sometimes when we get these headaches, we just use some painkillers without even paying attention to some other details. So in this video, we get to know much about what could be associated with this uh, when we have some symptoms too. So
But sometimes, and not that rarely, headache can be a symptom of a more dangerous underlying condition. It should be always recognized if these symptoms are in a combination with other symptoms such as anxiety.
yes, and sometimes these headaches could be associated with uh, some symptoms like anxiety, tachycardia. Tachycardia can also be called uh, the heart racing abnormally. So if it gets to be associated with this, we there are some things we need to pay attention to.
Racing heart, or tachycardia. This combination indicates that something might be wrong with hormones such as adrenaline and noradrenaline.
Yes, as we've said, if in a case where these symptoms are associated with anxiety or tachycardia, there might be some defects in our adrenaline and noradrenaline.
These hormones are produced by the adrenal glands, and the adrenal glands sit on top of kidneys.
So leading us to knowing where adrenal glands, adrenaline and noradrenaline are produced, which it is both produced from our thyroid gland. Now, our thyroid gland is located in the neck.
This can be truly dangerous because the condition that can mess up these two hormones has a mortality rate of almost 100% if not diagnosed and treated. First,
So, our headaches being associated with these two hormones will be dangerous if it is not treated and it is not treated when it is noticed. So we need to know how to diagnose this. So the process to follow to be able to know, to be able to treat ourselves and be able to know if this is really associated with the adrenaline gland.
while this condition is hard to diagnose by measuring adrenaline and noradrenaline because these hormones fluctuate so much that a meaningful analysis.
So to do the measurements with adrenaline might not be accurate as these both hormones fluctuate. So you may not get a meaningful analysis out of the results.
It's not quite possible. So how can we diagnose what's causing these adrenaline or noradrenaline fluctuations, and is something causing it at all? Before I explain this, I would like to ask you to do something for us.
So we would now like to explain um, the better way to do the analysis of this so we can get some accurate results. So
You see, YouTube and other websites suggest videos based on subscriptions and likes. And yeah, that's what I was about to ask. If you can, please help us reach more people with these issues and spread the information. And you can help us do that by subscribing now. Somewhere there should be a button, and liking the video. So
before we go to the explanation of that, we would implore you to subscribe to our channel. As you know, YouTube brings videos based on likes and subscription. You can even turn on your notification to get notified when some videos are released. It would help let people be enlightened about how to take care of their health accurately, and probably when they feel some distress, they get to know how to go about it.
Diagnose this condition, a skilled doctor should be able to assume the presence of a tumor of the adrenal gland called pheochromocytoma.
So for proper diagnosis of this headache associated with tachycardia, anxiety, so a skilled doctor, like if you visit hospital, the skill will be able to to locate a tumor called pheochromocytoma.
And that is the answer that we've been looking for. Pheochromocytoma can cause an increased secretion of adrenaline and noradrenaline, and diagnosing it's not always easy. One obstacle in diagnosing this condition is
So we're able to understand that this tumor associated this noradrenaline and adrenaline needs to be probably assessed, as it could be the cause of this headache.
Inability to diagnose it by simply measuring adrenaline and noradrenaline. We have to measure it indirectly by measuring metabolites, because adrenaline and noradrenaline are fluctuating too much. And as I've said,
probably to be able to access the this tumor correctly, we need to be able to measure the metabolites associated with the adrenaline and noradrenaline, not exactly the adrenaline and noradrenaline, as they both fluctuate, and we won't be able to get a meaningful analysis on this.
Meaningful analysis, it's almost impossible. Furthermore, medical imaging tests trying to visualize the tumor might reveal that tumor, but a proper medical imaging test has to be chosen in a proper setting. And so
to get this, there is a medical imaging test that is done, which will expose the tumor. And that is to be done in a proper setting in a good hospital.
In my opinion, the first thing, simply assuming that there might be a pheochromocytoma, is the hardest obstacle in diagnosing this condition. Simply questioning what might be causing this combination of symptoms. And there is this thing called a triad. And a triad is a combination of three symptoms that indicate a specific condition. And a triad for pheochromocytoma consists basically of headaches, night sweats, and tachycardia. However, not all of the symptoms have to be caused. And many of these symptoms are just general symptoms. And that's why a proper analysis of clinical presentation of the patient and of the constellation of symptoms is mandatory, and it can only be performed in a competent way by a skilled medical
Um, for proper assessment of um, the symptoms, there is need to go to a good general hospital to be able to get good assessment from skilled medical professional, because there is even a trial associated with this, and this could be some uh, anxiety and some other symptoms mentioned by him that you could face. And paying attention to this and for good health care is very, very important.
Professional. Both of you, patients and doctors, we have something for you. If you're a doctor and you want to make videos like these, then go to anatomsky.com. But if you have more questions about pheochromocytoma, then go to symptomsky.com/help/pheochromocytoma.
So, if in the end, if you are a doctor and you would love to be making much of this video to help uh, people with different deficiencies, you can go to www.anatomsky.com. And if you have more questions on the pheochromocytoma that we've explained in the video, you can go to www.symptomsky.com. And Symptomsky is now present in Nigeria, so it's present in in our country. So we would be seeing more of this video from now. We'll get to explain to you some tips about your health. You get to know how to go about it.
Chromocytoma.
So in the end, thank you for watching this video. Do not forget to subscribe and turn on the notification to get more of this. Thank you.